Hello, it's Bruce Williams again, and it's time for part 7 of my series on the selected gross pathology of the liver and biliary tree. And in part 7, we're going to talk about neoplastic disease of the liver. As I do at the beginning of all of my lectures, I want to thank those friends and colleagues who have provided me images over the years, which allow me to put these lectures together. Let's start with a non-neoplastic lesion of the liver, which is known as nodular hyperplasia. There's always a lot of confusion about the various lesions of the liver, whether they're areas of nodular hyperplasia, regeneration, adenomas, or carcinomas. Nodular areas of hyperplasia, a lot of people don't believe in because they believe that they are hepatomas or benign adenomas. But in order to keep up with the literature, we're going to include them in this lecture. And nodular areas of hyperplasia in the liver are often mildly expansile, and they may have a different color than the hepatocytes within the surrounding normal liver because they often treat glycogen and fat somewhat differently. They might accumulate it or develop it more, not get rid of it, and they're often seen at necropsy as expansile areas of discolored liver. These nodules are common in older dogs, and as opposed to humans, rodents, and fish, rarely progress to overt malignancy. There is no breed or sex predisposition, but the incidence certainly increases with age. Now, histologically, where we get a lot of our real diagnoses, because it's often very difficult to differentiate between different types of hepatocellular tumors simply on gross appearance. These nodules contain all the elements of the normal liver, the hepatocytes, the portal veins, the biliary tree, but they have a mildly distorted pattern to the hepatic architecture. When we look at hepatomas, you rarely will see more than one portal triad because they're a proliferation of the hepatocytes. But these areas of nodular hyperplasia are pretty close to normal, except for maybe the gross appearance of the hepatocytes. And that takes us to hepatomas. Hepatomas, or hepatocellular adenomas, are usually discrete masses. There may be one, there may be multiple, and they range from 2 centimeters to over 12 centimeters in diameter. They tend to compress, but they don't invade the adjacent parenchyma, but that is something that you really need to look at under the microscope. They are rarely harder than the surrounding liver, and often may be softer because they don't have a fibrous connective component. This is important in differentiating them from malignancies or from regenerative nodules, which we looked at when we discussed cirrhosis in lecture number 6. They often are a slightly different color than the surrounding parenchyma, which may be a combination of little changes in the way they handle fat or glycogen, or also just because you are compressing a lot of additional cells into the same space. And regardless of tissue, that often gives a lighter color than the surrounding normal tissue because you don't have the vascularity that the normal tissue does. Those extra hepatocytes are sort of compressing the blood flow there. Because they do have sort of an abnormal blood flow due to the proliferation of hepatocytes in this space, you may see areas of hemorrhage and necrosis grossly as you cut into these tumors. Hepatocellular adenomas are seen in a wide range of species, including dogs, cats, cattle, sheep, and pigs, and are probably underdiagnosed because of the lack of distinct criteria for their differentiation. Why do animals get hepatocellular adenomas? Is there a stimulus for this? Well, it may be some of the same reasons that we see hepatocellular carcinomas. There may be chemical carcinogens, but as a general rule, there isn't a good story as to why hepatocellular adenomas pop up. When we talk about chemical carcinogenesis, we certainly have to talk about the incidence of hepatic adenomas and malignancies in fish. The connection between pollution, contaminated water, and fish hepatic neoplasia has been known about since the 1960s, with quite a few different type of toxins being considered to be responsible in areas of pollution. Aflatoxins, dimethyl nitrosamines, all of these and most pollutants will cause an increase in incidence in the prevalence of hepatocellular tumors in fish. Question is, why is the liver more often targeted in neoplasia in fish than in mammals? And the thought is because fish liver grows throughout life, whereas mammalian livers tend to be quiescent unless damaged. Another thing about fish tumors is that compared to mammals, fish tend to show mixed hepatic neoplasms composed of both biliary and hepatic components, whereas in more higher evolved vertebrates, they tend to either be one or the other. Okay, this is hepatocellular carcinoma from a dog. It is extremely large, well over 12 centimeters. There are multiple areas within the liver. And if you felt this might be harder than the surrounding tissue due to a fibrous connective tissue component. Once again, we see this in a wide range of species. Most of the diagnoses are made on histologic appearance rather than gross appearance. It's very important to realize something that Dr. John Cullen, when he was lecturing at the JPC and at the Northeast Veterinary Pathology Conference last year, mentioned. And he has looked at more liver tumors than probably anybody in the world. And when you're looking at liver tumors, the diagnosis of hepatocellular carcinoma and hepatocellular adenoma is not always clear-cut. But even more importantly, hepatocellular carcinomas, even though they're malignancies, very, very rarely will ever metastasize. The chances are that this tumor is going to get bigger and bigger, eventually rupture, and the animal will die of hemoabdomen rather than metastatic disease. Hepatocellular carcinomas may cause a number of other problems, not just liver failure in terminal cases and all the other diseases that go along with that, like coagulation defects and icterus, and etc. But some may release various growth factors. Insulin-like growth factor has been documented as causing diabetes mellitus in dogs with hepatocellular carcinoma. There are many different histologic types that are categorized in hepatocellular carcinoma. But one of the things that you will note is that there are no portal areas, there are no portal veins, and that often you can have very, very broad trabeculae of 3 or 4, or even sheets of cells. Hepatocellular carcinomas don't always show a lot of pleomorphism. As a matter of fact, the minority of them will do that histologically. So it's important on these to take a number of sections to differentiate them from hepatocellular adenomas. And one section in a large tumor is just usually not going to be enough to give you a definitive diagnosis. I think that the literature is a little skewed in terms of what is benign and what is malignant, because the criteria for these tumors continues to evolve and change, And the bottom line is animals can die of both large adenomas and carcinomas because of the carcinoma's tendencies not to metastasize, and the chance of dying from hemorrhage from a large and necrotic tumor. Here's a pig, and a pig with hepatocellular carcinoma. These tumors are considered fairly common in Vietnamese pot-bellied pigs, if you are doing pot-bellied pigs, but the histologic criteria is pretty much going to be the same. There's a very nice paper on this published out of the University of Pennsylvania a number of years ago, which described 29% of a group of Vietnamese pot-bellied pig. 29% had this particular tumor over a 3-year period. They describe intrahepatic metastasis in about 50% of cases. I'm not totally sold. I guess I'm old school, and I believe metastasis means moving to a different site rather than neoplasm, within the same organ. How do you tell that that's just not another malignant focus? I would imagine if an animal gets into some sort of toxin, you can have the same process occurring at different parts of the liver at the same time. To me, that doesn't really represent metastasis. There is a pretty strong connection between a number of inciting agents and hepatocellular carcinoma. We've talked about the potential for various toxins to cause hepatocellular tumors. Both viruses and bacteria often will cause hepatocellular carcinoma as a result, likely of chronic inflammation. Hepatinoviruses, the virus that causes hepatitis B, often causes hepatitis in a variety of various species. Man, obviously, and other primates. Woodchucks, also known as marmots or groundhogs, have a hepatinovirus that very classically causes hepatocellular carcinoma, and this has been used for many years, especially at Cornell University, to investigate viral-induced hepatocellular tumors in humans. Other species that have hepatinoviruses include a number of other rodent species, including tree squirrels and beachy ground squirrels, and there are some bird species that have hepatinoviruses as well, including Peking ducks and a couple of types of herons. The viral DNA of the hepatinovirus is generally integrated into the host cell genome at or near the locus of C-mic or N-mic, and there is a lot of ongoing damage and inflammation in the rest of the liver as a result of induction of cytotoxic T lymphocytes directed against infected hepatocytes and other cells within the liver. So this is a hepatinovirus, well known. And here is the liver from a chimpanzee. And over the years, we had received a number of these from a particular facility who had a higher than normal incidence of hepatocellular adenomas and hepatocellular carcinomas. And ultimately, we suggested that they might want to test the animals for hepatinovirus, and lo and behold, it turned out that all the chimps were infected with the hepatitis B virus. Just a couple of other toxins that I did not mention. The cycad toxin and schistosomes is something that, blood flukes is something that in humans have been incriminated in a higher than normal incidence of hepatocellular carcinoma. Now, the story of the A strain mouse and Helicobacter hepaticus is one in which prolonged inflammation can often cause an increase in the incidence of hepatocellular carcinoma. Here is the liver from an A-strain mouse, and this connection has only been repeated in A-strain mice. There are a lot of different strains that can be infected with Helicobacter hepaticus. It causes a pretty profound inflammatory lesion that histologically, when I see it, looks like nothing else that you see in mice with the oval cell hyperplasia and marked Kupffer cell hyperplasia. It's a great lesion. And then superimposed on this, in the A-strain mice, you'll see multiple hepatic tumors, including hepatocellular adenomas and these large hepatocellular carcinomas. It's usually seen in males for reasons that I don't know. And then mice and rats, I would say that they do get a fair number of hepatomas and hepatocellular carcinomas as a result of simply old age, and then these bacterial pathogens, and obviously they have been used in carcinogen research for so many years, and the liver is often targeted by a number of carcinogens. Now today we can knock out a gene or knock in another gene, and we will get hepatocellular tumors all day long. But mice and rats have been a very strong model for hepatic carcinogenesis over the years. Okay, let's leave hepatocellular tumors, take a look at tumors of the biliary tract, the so-called cholangiocellular carcinoma. Some people call them biliary adenocarcinomas. That's fine too. And these are usually multiple neoplasms. They tend to bulge from the surface, and they are very firm and white. As composed of hepatocellular tumors, these tumors, the tumors of the biliary tract, will incite a pretty profound desmoplastic response with a concurrent formation of fibrous connective tissue. So they tend to be hard, and even more importantly, from a gross perspective, biliary tumors tend to have an umbilicated center. And remember, these tumors grow. They're putting down a tremendous amount of fibrous connective tissue. Sometimes, in some parts of the tumor, you may be hard-pressed to find the neoplastic epithelial cells because there will be such a profound serous or desmoplastic response. And then what happens in the oldest part of the tumors is, remember, all scar tissue will retract. It contracts down. That's just the nature of fibrous connective tissue. It's like a scar. And so the oldest part of the tumor tends to be drawn in on itself, and the biliary tumors are often umbilicated, or any type of epithelial tumor often over time will become umbilicated. Here's another one in a dog, and you can see the umbilicated and multifocal nature of these tumors. These tumors, especially in cats, will occasionally explant to the adjacent omentum or the mesentery, and you can get the syndrome known as carcinomatosis as it spreads along that mesentery, eventually contracting. Now, one of the problems with identifying this particular tumor grossly, especially in dogs and cats, is that a lot of different epithelial tumors will go to the liver as part of metastasis. They're epithelial. They can have a very similar appearance. So if I see this in a cat, I'm going to think about some other neoplasms as well, particularly mammary neoplasms, which may look identical. And obviously this is one that we want to send out for histology to make sure that we can give a positive diagnosis of biliary carcinoma. Biliary carcinoma, or cholangiocellular carcinoma, or cholangiocarcinoma, whatever you want to call it, is also very common in birds as well, especially psittacines. It's probably the most common hepatic neoplasm of birds across the spectrum. Even in poultry, we see a lot more biliary carcinomas than we do hepatocellular carcinomas. They're not always confined to the liver, and they can be extrahepatic as well. But if you look at the color of this liver, you see the whitish appearance due to the tremendous amount of desmoplasia that is usually associated with these tumors. These birds, because birds often do not show signs of illness until it's very advanced, may undergo sudden death, or they may exhibit other forms of liver failure, including hepatic encephalopathy, when they can no longer take ammonia out of the system. Usually you can pick up that they have a really hard, big liver in them when they're this well advanced. Okay, let's talk about what has been considered the most common primary hepatic neoplasm in the cat and a number of other species, including ferrets, and that is the biliary cystadenoma. And this is a very interesting lesion because I think that quite a few of them have been misdiagnosed over the years. Early on in the first lecture in this series, we talked about developmental abnormalities and ductal plate malformations of the liver. And this, over the years, has been identified as a tumor. But I think as we go back and experts in the field start to look more and more at these previously diagnosed tumors, we will find that a lot of these are developmental abnormalities where the tertiary and secondary bile ducts don't form together. Over time, they will dilate. They will secrete sort of a proteinaceous product into the lumen of these isolated ducts, and these lesions will, quote unquote, grow like tumors. The other thing that is interesting about this is that you often have cysts elsewhere, and it just doesn't really make a whole lot of sense. Here's one that was diagnosed as a biliary cystadenoma in a ferret. These tumors, whether it's a cat or ferret or other species, they're extremely thin-walled. They're lined by incredibly benign, attenuated epithelium that becomes even more attenuated. And I think that we have overdiagnosed these. They often pop up on the edge of the liver lobes, where we definitely have a lot of developmental abnormalities called von Weinberg complex, and they do not ever metastasize. They can become very large, but you'll always see multiple cysts throughout the liver. So I think that when you are looking at these lesions, the temptation is there to call them a neoplasm, that obviously our customers want a tumor. If they're going to go and do a lobectomy, they want a good tumor out of it. But be very careful, because I think that these will ultimately, if someone takes the time to go back and look at these, most of these could be reclassified as ductal plate abnormalities. Okay, great picture from Dr. Christella Pearl when she was at Memorial Sloan Kettering, and it's a big liver and it's a big spleen in a mouse. And if you've looked at the lectures on a mouse pathology, when I see those two things, big liver, big spleen, I'm thinking lymphoma. Lymphoma. It's incredibly common in mice. Probably about 98% of these will be a lymphoma. People who work with mice on a daily basis, they don't even bother running immunohistochemical stains. So the big liver, big spleen, lymphoma. And when we look at lymphoma, it is going to be the most common non-primary neoplasm of the liver in just about any species. We see it in all species, always gets targeted. The liver has just a tremendous blood supply, and it can get in there from a number of ways. So big spleen, big liver, even in the absence of any big lymph nodes, we're still going to go with lymphoma in mice. And you're saying, hey, that's a nude mouse. It doesn't have any lymphocytes. How can it have lymphoma? Okay, basically, nude mice have plenty of lymphocytes. Okay, they just don't work properly. The receptors on the surface, which allow them to recognize various antigens, are not put together correctly, but they certainly have lots of lymphocytes. And the other thing is that when you get a neoplastic clone of these ineffective lymphocytes, the body can't shut it down. doesn't have the wherewithal. We probably get, 5 or 10 neoplasms every day, and our body recognizes them quickly and just eliminates them. But when your T and B cells don't work, you can't shut it down. So it just takes, every mouse has plenty of different retroviruses in it, just waiting for the right hit, and then we're going to start with lymphoma or mammary tumors or something like that. And so that's probably what happens in these animals. They get a clone of neoplastic lymphocytes going, they don't have the immune system to shut it down. So that is why lymphoma is a leading cause of death in older immunosuppressed mice. Well, it's a big liver and it's a big spleen, and so that's going to be lymphoma as well. Well, remember that I said about 2%, maybe 3% are going to be other neoplasms which can do that. And the second most common that you will see, especially in B6 or SJL strains of mice, is going to be histiocytic sarcoma. Very commonly affects the liver and spleen. You will also see a couple of other things that you're going to look for in these animals. A lot of times these cells may be relatively pleomorphic, but they might not be, and you want to differentiate from lymphoma. Things that I'm going to look for. Number one, if we're looking at a female, let's look for the presence of a uterine neoplasm. They're commonly seen in the uterus in affected females. Other things that you're going to see, because these tumors tend to produce lysozyme, you may see increased amounts of red to pink droplets within the proximal convoluted tubular epithelium, because it tends to. Now, maybe a little tough because male mice tend to produce a lot of proteins as well, but if you have a couple of mice, you have a normal control mouse, especially a female, look at the amount of protein in that and compare it to this, and I will bet you that you're going to have more protein. You may also, these tumors also cause an increased erythroid hyperplasia within the bone marrow, and sort of consequently a decreased myeloid. But the bone marrow in these animals is often just popping. So those are a couple of other things that you can do if the histology of the neoplastic cells does not sway you. One other thing to look for is, it goes along with that erythroid hyperplasia. You're going to have a lot of EMH in and around the tumor, especially in the liver. So look for that. So a couple clues to help you to weed out that 2 or 3% of histiocytic sarcomas that end up with hepatomegaly in mice. In mice, when you get tumors of the liver, especially lymphoma, histiocytic sarcoma, it tends to be more of a diffuse hepatomegaly, as opposed to some of the other mammalian species like dogs and cats, which can be simply enlarged due to a diffuse distribution of neoplastic cells, or you may have discrete nodules within the liver. Here is the liver from a chicken, and this chicken liver is very large, is extremely friable, and it is discolored. And so we're going to think about lymphoma in poultry as well. A hard lesson that I've learned over the years is that I cannot differentiate grossly and often not histologically between the 3 different virally induced types of lymphoma in chickens. And I've almost finally just thrown up my hands, and this is avian lymphoma due to infection with avian herpes virus type 2 or Marek's disease, a disease of T cells that affect a number of organs, but can affect viscera as well as affecting nerves, affecting the skin. It affects a wide range of organs. And I used to say, well, if it is hitting the viscera, it is more likely this one. This is avian retrovirus, also known as avian leukosis or lymphoid leukosis, and it can cause diffuse splenomegaly and infiltration that looks just like this, or it can cause these nodules. It tends to be a neoplasm of B cells, so the bursa will often be involved, but I can't tell you how many times I've, guessed one and was proven to be the other. Dr. Cindy Bell gave me a nice tip, which helps a little bit if you are taking histologic sections, and that if you look at the tumor cells in Merrick's disease, especially in the viscera, they tend to look a lot more beat up. Not very pristine, as opposed to those that are caused by retrovirus, which look a little better. But take it from me, almost impossible to tell the difference. And with so many backyard birds that we see, and flocks and fancier flocks that people have, if they're oftentimes willing to accept a sort of a background incidence of this at 2 or 3 or 4%, rather than actually just spend the money to help figure out what virus they have. Obviously, if it's a retrovirus, you're not going to get rid of it. And most of these people aren't that interested in getting rid of it anyhow. But certainly for large producers, you want to be able to go and find out exactly which virus is causing this. And this is the last one. This is the one that's a little bit more rare and tends to cause either B or cell neoplasms within the liver and other organs. And this is the reticuloendotheliosis virus, which you see in chickens, but runs a distant third in incidence to Merrick's disease and lymphoid leukosis. But if you can tell all these apart grossly, you are a better gross pathologist than I am. Here's a calf with lymphoma. Okay, the liver is commonly involved in lymphoma due to bovine leukemia virus, another retrovirus that will cause lymphoma. The retroviruses get into your DNA and they just wait for the correct hit which turns them on, and then all of a sudden you have lymphoma. This one is nodular, and this adult, or at least older animal, beautiful picture by Dr. Derek Mosier, this had a huge liver, and this is diffuse infiltration by lymphoma. So, certain species, tumors in the liver, you start with lymphoma and you work backwards from there. Cats are another one that get a lot of hepatic lymphoma. Now, I'm not showing you a picture of lymphoma here. A great picture from Dr. Jim Carpenter when he was working at Angel Memorial. And it's a beautiful picture, and you can see this reticulated pattern. And if you said this was lymphoma, I wouldn't have a lot of trouble. If you said it was early hepatic lipidosis, probably wouldn't tell you. And this is sort of the problem with gross pathology in the liver, especially in cats. A lot of diseases look alike. Now, this is a disease that is on a spectrum. I think it's on a spectrum with hepatic lymphoma, and it's one part of the spectrum. And given enough time and enough energy, may progress to lymphoma. And this is cholangiohepatitis in cats, where you get infiltration starting in and around the portal areas of large numbers of lymphocytes which are inflammatory. They have not crossed the line. And I can tell you sometimes it is extremely difficult to tell the difference between an advanced case of cholangiohepatitis and a case of lymphoma. This is where some of the advanced testing, like clonality and PPAR, will help us if we need to tell the difference. A lot of times these animals are very sick. They're not eating. They may go on to develop secondary hepatic lipidosis to confound their problems. But it can be a very difficult histologic diagnosis in these advanced cases to tell them from early lymphoma. Not something that I look forward to when it crosses my desk. Oh, here's a beautiful picture. The best liver pictures always have a background of hepatic lipidosis, so this animal may have had one of the diseases causing hepatic lipidosis, like diabetes. This is a dog, and there is a very large mass, hemorrhagic. This is hepatic hemangiosarcoma on a background of hepatic lipidosis. I would also think about hypothyroidism, which is not that common in dogs, but could certainly cause a background of hepatic lipidosis. The other possibility for this discolored liver might be something like the animal's been on steroids because it was at death's door, and they just wanted to make sure no dog should die without a good blast of steroids. Over time, if you do that enough, you're going to get a discolored liver due to steroid hepatopathy. Okay, but let's go back to hemangiosarcoma is why this dog is in the lecture. And the liver is one of the top 3 sites for development of hemangiosarcoma in the dog, the other 2 being the spleen and the right atrium. So very common. These animals often will die of hemoperitoneum. And this is a really nice, fairly cellular tumor. Look, there's some white areas, which are areas of really proliferating endothelial cells where you don't have a lot of hemorrhage or they're not making very good blood vessels. So you have all sorts of variations. So here's one that protruded from the surface, and here's another form that you will occasionally see in the dog. Once again, some nice hepatic lipidosis, so it shows up. Normal liver is tough to really pick out the hemangiosarcoma, but look at these areas of parenchymal loss. They're actually divots. They are depressed areas, which you can see through the capsule. You can tell we've just lost hepatocytes. They've been replaced by endothelial cells. And hepatocytes are big fat cells. Endothelial cells are little small skinny cells. So when you replace the hepatocytes, you may get in these sort of poorly cellular hemangiosarcomas, you may get these depressed areas in the subcapsular parenchyma. Don't let that put you off of your gross diagnosis of hemangiosarcoma. Oh, this is a fun one you occasionally see in cats. You may see it in the liver, the spleen, or the intestine, and this is a mast cell tumor. Some people call it systemic mastocytosis. Nobody really knows. It often affects the bone marrow as well. I think the intestine is probably the most commonly affected. It has no relevance or bears no connection to mast cell tumors of the skin. It's a very different entity, and these animals will often have this in multiple organs. And you can see the discoloration, sort of the increase in size of this liver because it's been infiltrated with large numbers of mast cells. Histologically, it's the easiest diagnosis to make. And as long as you're familiar with the syndrome, it'll be fun, but it won't be any great shakes in terms of diagnosis. Let's just look at a couple more sort of rare tumors. This is the liver from a cheetah. And when I say cheetah, a couple things should go off in your head in terms of liver. We looked at veno-occlusive disease in animals that are maintained on long-term contraception in our last lecture. And another neoplasm that cheetahs get is either in the spleen or rarely in the liver. You're going to see multiple myelolipomas. And a myelolipoma is just what the name says. These are benign tumors. They're expansile. They compress the adjacent parenchyma, and they're composed of extramedullary hematopoiesis, primarily of the myeloid lineages, scattered through a bunch of fat. Neither of them really belong there. And when you see them together in the spleen or the liver, it's a myelolipoma. I've never seen anything malignant about them. You can see a lot of them, but they don't, and they go to the liver, and they pop up in the liver, spleen, and they don't really do anything. But cheetahs are well represented in the literature for getting myelolipomas. And our last neoplasm is also from a cat, and this is a black neoplasm scattered throughout the liver, and this is a melanoma. And I've seen a number of these. They often will pop up from melanomas in and around the eyes, especially the conjunctiva. It's interesting. The melanoma that cats get in their iris, the most common form, rarely goes anywhere, does anything, but it's the one that is on the conjunctiva that tends to go haywire and cause severe metastatic disease, often to the liver. This was a submission from the Wednesday slide. We get one of these every couple of years. We also get the T-cell epitheliotropic lymphomas from dogs and cats, in which the T-cells actually they're attracted to those hepatocytes, and they may get inside the hepatocytes as well in a process known as emperopoiesis. But this one's a melanoma, and this is why you have to be very vigilant on the conjunctival or limbal melanomas in cats. Okay, well, that is lecture number 7. We are going to finish up the liver and biliary tree in lecture number 8. I've touched on some of the diseases that affect the biliary tree in the previous 7 lectures. A lot of those spill over and will damage the hepatic parenchyma. In our next and last lecture in this series, we're going to look at diseases of the biliary tree and gallbladder that stay restricted to that particular organ system. And I look forward to putting that lecture together and finishing these lectures on the liver and biliary tree. I hope you've enjoyed them. I certainly have enjoyed putting them together. And I look forward to seeing you again on the Foundation's YouTube channel or Facebook page. Everybody have a fantastic day.